Cryolipolysis is a medical treatment used to destroy fat cells. Its principle relies on controlled cooling to near 4 Celsius for the non-invasive localized reduction of fat deposits in order to reshape body contours. The exposure to cooling is set so that it causes cell death of subcutaneous fat tissue without apparent damage to the overlying skin. The procedure is billed as a non-surgical alternative to liposuction. Cryolipolysis is a portmanteau of cryogenic and lipolysis. Generically, the process can also be known as fat freezing. In Europe, cryolipolysis machines are used in aesthetic clinics and spas. Brand of devices include CoolSculpting Clatuu, isoLipo and 3D lipo. Evidence: cryolipolysis is used for removing certain areas of body fat that are just under the skin to contour a person. Evidence supports its effectiveness at 3 to 4 months. It appears primarily applicable to limited discrete fat bulges. With a small number of people treated, clinical data remains scarce, thus it is not known how long the treatment effect will last, or when and if later treatments would be necessary to maintain the result. Side effects: side effect data are based on a limited experience. Transient local redness, bruising and numbness of the skin are common side effects of the treatment and are expected to subside. Typically, sensory deficits will subside within a month. The effect on peripheral nerves was investigated and failed to show permanent detrimental results. No serious long-lasting side effects were encountered during follow-up time of 6 months. Method of action: lipolysis procedures attempt to dissolve fat cells by non-surgical means. A number of methods have been attempted, including the use of laser, ultrasound, and radio frequency current. Popsicle panniculitis is a dermatologic condition that shows that exposure to low temperatures can selectively damage subcutaneous fat while leaving skin intact. Based on the premise that fat cells are more easily damaged by cooling than skin cells, cryolipolysis was developed to apply low temperatures to tissue via thermal conduction. In order to avoid frostbite, a specific temperature level and exposure is determined. Physicians Dieter Manstein and Rox Anderson at the Wellman Center at Massachusetts General Hospital originated the concept, explored it in a number of experiments on pigs, and reported their data in 2008. While the process is not fully understood, it appears that fatty tissue that is cooled below body temperature but above freezing undergoes localized cell death followed by a local inflammatory response, a local panniculitis, that gradually over the course of several months results in a reduction of the fatty tissue layer. When exposed to extreme cold, the body's usual response is to restrict circulation to keep the core of the body at the correct temperature. Cryolipolysis makes use of a powerful vacuum which adds to the inflammatory response by drawing blood up to the surface layers of the skin. Cost and treatment time: typical cost per treatment area ranges from $750 to $1,500 depending on the size of the applicator and the area being treated. Treatment time for general use application is between 45 to 60 minutes per site. Some cryolipolysis devices have a pair of applicators that can be used simultaneously, reducing the overall treatment time when treating corresponding areas such as the sides of the stomach, back of legs and flanks. Regulatory approval: in September 2009, Zeltiq received EU CE mark approval for their cryolipolysis device. In September 2010, the U.S. Food and Drug Administration approved the cryolipolysis device and procedure. References: ABCD Kruger N., MySV, Leeuweberding S., Siddiq S. Cryolipolysis for non-invasive body contouring, clinical efficacy and patient satisfaction. Clincosmetinvstig Dermatol. 7, 201 €5 doi, 10.2147/CCIDS 44371. PMC 4,079,633. PMID 25,061,326. Ingarja, M.J. Motakv, S. Chung, M.T. Vascones, H.C. Sasaki, G.H. Cryolipolysis for fat reduction and body contouring, safety and efficacy of current treatment paradigms. Plast Reconst Serg 135, 1581 €90 doi, 10.1097/PRS000000000001236. PMC 4,444,424. PMID 26,017,594. Derek, C.D. Shridharani, S.M. Broyles, J.M. The Safety and Efficacy of Cryolipolysis, a Systematic Review of Available Literature. Oesthetserg J35, 830 Euro 6 doi, 10.1093 SJV039. PMID 26,038,367. A.B. Nelson, A.A. Wasserman, D. Avram, M. Cryolipolysis for Reduction of Excess Adipose Tissue. Seminars in Cutaneous Medicine and Surgery 28, 244 Euro 9 doi, 10.1016/JSDER. 2009.11.004. PMID 20,123,423. A.B. Coleman, S.R. Sachdeva, K. Egbert, B.M. Preciado, J. A.L. Clinical Efficacy of Non-Invasive Cryolipolysis and Its Effects on Peripheral Nerves. Aesthetic Plastic Surgery 33, 482 Euro 8 doi, 10.1007 per second 00266-008-9286-8. PMID 19,296,153. Ingardula M.J., Moteg Fes, Chung Mount, Vascones H.C., Sasaki G.H. Cryolipolysis for Fat Reduction and Body Contouring, Safety and Efficacy of Current Treatment Paradigms. Plast Reconst Serg 135, 1581 Euro 90 doi, 10.1097/PRS000000000001236. PMC 4,444,424. PMID 26,017,594. Avram, M. Harry, R.S. Cryolipolysis for Subcutaneous Fat Layer Reduction. Lasers in Surgery and Medicine 41, 703 Euro 8 doi, 10.1002/LSM 20864. A.B. Manstein, D. Labge, H. Watanabe, K. Farinelli, W. A.L. Selective Cryolysis, a novel method of non-invasive fat removal. Lasers in Surgery and Medicine 40, 595 Euro 604 doi, 10.1002/LSM 20719. PMID 18,951,424. Zulixon, B. Egbert, B.M. Preciado, J. Allison, J. A.L. Cryolipolysis for Non-Invasive Fat Cell Destruction, Initial Results from a Pig Model. Dermatologic Surgery 35, 1462 Euro 70 doi, 10.1111 per Joule 1524-4725.2009.01259x. PMID 19,614,940. Zeltiq, Classes. Zeltiq announces European CE mark approval for non-invasive fat layer reduction using cryolipolysis.